Hi, I'm Nick the nurse. Today we're going to be talking about the involuntary commitment of individuals versus voluntary commitment. Now, in a mental health setting, there are two major types of patients, those who voluntarily commit themselves and those patients who are involuntarily committed. First of all, let's talk about those patients who are voluntarily committed. Voluntarily committed patients are those patients who might feel very depressed. They might even suffer from really bad postpartum depression. What they do is they walk into a mental health facility and they commit themselves because they themselves recognize that they might be a harm to themselves or to others, and they basically relinquish themselves to the control of the facility. Now, they can always sign out later when they're better, but that's what happens when you have somebody who's voluntarily committed. Now, we can also talk about those patients who aren't involuntarily committed. Now, you see a lot of examples of this in movies like Shutter Island with Leonardo DiCaprio. Excellent psych movie, by the way, if you want a little more perspective on mental health nursing. But at any rate, involuntarily committed patients are those patients who are either by a physician or a judge involuntarily committed to a facility because they meet two criteria. One of two criteria. Either they're a threat to themselves or they're a threat to who? To others. Basically, if they're suicidal and it's a legitimate suicidal ideation or attempt, or if they are striking out and really want to hurt somebody, these are reasons that we might involuntarily commit somebody. Now, we always have to make sure that we're using good legal safeguards. And again, I'm not a lawyer and I can't give legal advice, but in terms of delivering competent nursing care, we have to make sure that we still respect the autonomy of patients who are involuntarily committed. So remember that on the NCLEX. But usually this requires some type of higher up, either doctor or committee of doctors or the administrator or maybe even a judge in certain cases, involuntarily committing a patient to a mental health facility. So make sure that you understand the difference between voluntary and involuntary commitment as you study for your nursing school exams and for the NCLEX. Best of luck, and see you next time.